All right, hello everybody. Welcome. We'll give it another minute to let folks come in. Usually there's a bit of a lag for a few folks. Okay, getting a little rush here as 3 o'clock comes. So give me another second. I will introduce myself. So I'm not saying anything too valuable for the next minute. Hi, everybody. I am Jenna England. I am head of partnership developments for Food Rescue Hero. We are a network of organizations using technology to facilitate food rescue, picking up from donors and getting it to people who need it. We will, I guess I'll go ahead and get started. I'd like to ask you to hold your questions until the end, although you can drop them in the chat or into, I think there's a Q&A, but we'll answer questions at the end. I also want to introduce Jake Tepperman, my right-hand man here. Jake started at 412 Food Rescue as our dispatcher and has done all things food rescue and now works with Food Rescue Hero, again, helping our partners implement technology and problem solve. Today, we're going to talk about increasing food access in your community, not just food, but food access. Food access, this is the technical term, it's the spatial accessibility and affordability of food. So a number of things can impact an individual or a family's ability to access food. Things like travel time to shopping, also transportation to shopping. So individuals that don't have a car, that are reliant on public transportation, that can dramatically impact how they're able to access food. Food prices and the amount of disposable income after paying, your solid bills like rent and utilities, and how much you have left over for food. And the availability of healthy foods is really important to think about when we talk about food access. Traditional places of food access points include places that you can buy food, like grocery stores, farmers markets, even fast food chains like McDonald's, but then also food banks, food pantries, and soup kitchens. Historically, as we talked about individuals and communities' access to food, we talked about food deserts, where there was not a lot of places to purchase food. So that's kind of gone out of fashion. And now we're talking about things like food swamps, where there's food available, but most of the food that's available is highly processed food, fatty foods, salty foods. And those foods can cause a lot of health issues for people. So one of the things that you'll start to hear a lot of talk about right now are social determinants of health. And these are factors that are impacting people's health that are not their genetic makeup, or not things that they're specifically doing wrong. So for example, if you live in a community where you can't access food and the only thing you can access are highly processed foods, fast foods, that's going to impact your health outcomes, right? And that is not a personal failing, that is a social impact, a social determinant. And we know now that for people that are food insecure, that are facing a lot of challenges to getting enough food in their life and getting healthy food in their life, that has a real detrimental impact on their health. For children, it can affect their learning. It can affect how they can concentrate in school. It can even affect their brain development. For adults, it can lead to things like high blood pressure, high cholesterol, heart problems, diabetes, and all of those factors then are exacerbated yet again by an individual's inability to access the type of foods that they need in order to solve their health problems. Food rescue, we oftentimes talk about it as a way to, eliminate food waste and eliminate hunger, but food rescue also has the power to transform what food access looks like. Actually, one of the things to keep in mind is that for food rescue, the food that we're getting, the food that's most often wasted is highly perishable, right? 87% of what is rescued by the Food Rescue Hero Network is perishable food. It's not canned goods or dry goods. It's things that will go bad quickly. Things like fresh fruits and vegetables, even some prepared foods, right? And those foods are really often very difficult for people to get a hold of if they're living in poverty, right? Food rescue, because you're getting 87% fresh food, can really change food access and food outcomes for communities. So because of that network, or because of that amount of fresh food, we need to take food to places that can distribute it quickly. We found out, and I'm sure a lot of you on this call that are doing food rescue in your communities found out really quickly, that when you introduce all of that fresh food into the system, traditional food pantries can't necessarily handle it. Food pantries only distribute anywhere from once a month to maybe 3 times a week. They're often only open for a couple hours a day. If you have, let's say 10,000 pounds of cucumbers, the food pantry network in your city is probably going to be unable to distribute that quickly. So food rescue pushes you into thinking of outside the box distribution points that you can leverage to, first and foremost, I think of it as self-defense a lot of times, get rid of the food or distribute the food that needs to be distributed really quickly and eaten quickly, and get it to places that can distribute it. So you'll see here what I am asking folks to do is drop in the chat. What are some out of the box distribution points that you can leverage that will help you, number one, get all of that fresh food rescued and distributed and used quickly, but that also then might increase food access. So we don't necessarily go into it thinking about food access. Julia, can you just drop it in the chat so others can see it? Hopefully you have access to the chat. Yeah, drop your ideas for that in the chat so everybody can see. But most likely you're all already thinking about this or doing this if you're already doing food rescue. You've all been forced to figure out somewhere to take food that needed to be distributed quickly, that your local pantry couldn't take, that your soup kitchen couldn't take, that the places that, we sort of automatically think about taking our food to, those places couldn't handle it. I'm going
to stop you real quick. There's a couple of people talking. It's saying that the chat is disabled. As the host, are you able to open up the chat to the participants of the meeting?
I don't know. That's a great point. Okay. There we go. I am so sorry. It should be enabled now. Can somebody test it and let me know? Yes, excellent. Okay, fantastic. Thank you, everyone. I'm so sorry. My bad. It usually is automatically on. I'm not sure if we set that up and if we clicked that some box in Zoom that is now disabling chat, but we should probably check on that, Jake. So, oops, no, how do I go back? There we go. I'm going to go back to, so now drop those spots in the chat. Where are you taking food that, you know, anybody that's outside of this universe that's not doing this work would not maybe think of as a food access point? And I'm going to skip around my slides a little bit and look at some of the places that 412 Food Rescue and the other partners in our network are working with. One would be healthcare locations. A lot of medical clinics and hospitals are already really starting to focus on social determinants of health and realizing that if they want their patients to be healthy and not to come back with even more problems, then they need to help them access healthy food. And so we've had a lot of luck partnering with, as I said, healthcare systems, hospitals, pantries within hospitals, medical clinics, and other type of healthcare provider locations. Schools, daycares, and after-school programs are also a great way to get food to the families who need it most and get it there quickly. Why? Well, what is the number one thing a family is going to make sure that they are able to do every day? Pick up their kids, right? If their child is in daycare or if in after-school programs or Head Start programs, that is like baked into their routine. They already have that transportation worked out. They already have that time booked. They are going to make sure those kids are picked up, whether it's by them or the family member. Those are great ways to get food right to families. So when a family comes to pick up a child from their Head Start program, for example, they can get a bag of groceries, or they can get some, grab and go sandwiches and salads from the local convenience store. That gives them food for that night. That's dinner that night. So that's a really easy way to get food that has to be used quickly into the hands of people who need it and will use it quickly. And it transforms access for those families. For somebody that is maybe doesn't have a car and is working an hourly job, maybe even 2 hourly jobs, and is picking up their kids from daycare on the bus, getting on the bus or getting a Uber to a food pantry or somewhere that they can buy food is a whole other ordeal, right? Instead, you're taking away the necessity of figuring out those logistics and that time, that extra time, and you're just giving them food where they are already going. And that is really critical to transforming food access. And then housing. Housing is another really great option. We work with a lot of housing authorities and other housing sites, and they are they are great ways to distribute food quickly. Jake, can you take over for 1 second? I have to step away real quick.
Yeah,
we just talk about these three places.
Yeah, I mean, and we'll discuss some of the others in the chat. So I see Mutual Aid Society, which is a really interesting concept. The one I see is listed twice: transportation hubs. I'm not quite sure. It looks like Tara and Soraya, you had mentioned that. If you care to elaborate on what you mean, do you mean like train stations and public bus stations, or something else? Because that's certainly an interesting concept that I had never heard or thought of before, but could be really valuable. So if you wouldn't mind either one of you elaborating in the chat, that would be great, or raising your hand, and I can probably open up the function for you to speak. Yeah, of course, community meals that churches are doing is a great one. That's very popular. And then I see veteran centers, things like that. So yeah, all really wonderful places. Okay, I'm reading that. Bus transfer locations within city and rural. Thought of that either. Yeah, so public transportation sites, obviously the infrastructure there may be a little bit different than a church, in that you're not going to have people who are specifically dedicated to meal distribution, but it's certainly an access point. And if you have the staff or volunteer people who are set up at transportation hubs, that is a really interesting idea that I've certainly never thought of, and could be very cool. So yeah, thanks for those.
Hi, I'm back. I'm so sorry about that. Whew. Somebody was pounding on my door. I had to go see what was going on. Wasn't sure if the house was on fire or what was going on. So my apologies. Thank you, Jake, for taking over. And my apologies, everyone, for missing a minute. I'm going to go backwards for a second and then talk about how you can utilize this sort of network expansion to think about addressing food access and increasing food access in your community. So one thing that 412 Food Rescue did, and that is super easy to do, is we looked at food access points that were, available, mapped in the census, or we knew that there were pantries or food stores, and we put those on a map, and then we overlaid it with income information, poverty data, food insecurity data. And we were able to identify areas where there were no food resources within a 15-minute walk shed. And that's what those bright green areas were. And so we were able to then say, okay, well, this is an area that has a really high need. We should be able to go in there and find a non-traditional partner and establish a food access point. So there are no areas in Allegheny County that are not within a 15-minute walk shed of food, especially if they are an area of high food insecurity. And so because we're thinking outside the box and we're not looking simply at already existing in traditional structures, we're able to really transform what food access looks like in the county. And food rescue gives everybody the opportunity to do this in their county. We can completely transform what food access means county by county by using food rescue and rescued food in order to create new access points and providing healthy, fresh food within reach of people where they already are. Now, how do you do this? It's actually easier than you'd think. So let's start with housing, for example, because public housing and senior housing and places that get government money are required to provide services to their residents. And so food access on site can actually help them meet some of the requirements of their federal spending. Most any of the public housing or publicly funded housing that we've worked with has a resident services person. And that person, that's their entire job, is to work with residents. And so they are really great resources for distributing that food. We've also found that when we go to other places like, Head Starts, daycare centers, schools, after school programs, they're very aware that the accessibility of food and the accessibility of good food impacts the outcomes for their students. And so they are very willing to go outside the bounds of their initial directive to include food access. And I don't know that we've had too many organizations turn us down. There's a few that systemically it's just not, they're not there yet. But overall, we've had tremendous response from, everything from job training programs to housing sites to daycare centers that want to implement food distribution in their, as part of their programming in their community, because it is so impactful. And when we started, one of our first housing authorities was the city of Pittsburgh. And we got this letter from them within, I think, probably 8 months of starting to work with them, 8 months of starting to work with them, to really talk about the impact that this can make. When we started working with HACP, they had an emergency fund for food, and they would historically receive, as you can see, 5 to 7 referrals every month for families that didn't have food and that needed, an emergency intervention. Once we started working with them and bringing food into their communities, that dropped to 0. There were 0 referrals for families without food. And that continues to this day. This was in 2016. That has continued to this day. Even during the pandemic, we managed to get food into those communities and effectively eliminate hunger in the housing authority of the city of Pittsburgh. And part of it is, a rising tide lifts all boats. If there is a significantly more amount of food in the community and somebody knows someone is struggling, they're able to just take them a bag of food. They can, go to the distribution and take it to them if they're unable to go. And so it has been just a really incredible impact in those communities. And think about the opportunity that gives us all as we're doing food rescue is to take this impact at HACP and replicate that across, every housing authority, every low-income housing site, all of the childcare centers, everywhere that people are that are food insecurity. We can end hunger. We can literally end hunger with food recovery. And not only that, much of the food is that healthy food, is that 87% fresh food that people that are living with food insecurity need in order to better their health outcomes. So what that all adds up to is impact. Food recovery isn't just about ending hunger. It's not just about ending food waste. It's about the impact of affecting social determinants of health, of creating nutrition access, not just food access, and affordability, of alleviating and hopefully one day eliminating diet-related chronic conditions. It's about time. It's about creating time for families and individuals that add value to their lives in other ways. And actually it is actually here. The next point is dignity. It adds dignity. So all of those things, time and better health outcomes, add up to the dignity of food access, being able to get food where you are instead of having to go to, the back door or to a special location. It's picking up a bag of groceries when you pick up your kids. It's having the time to go to their baseball game, their little league game, instead of having to take an Uber across town to a grocery store to make sure that you have food. Gives people time for education, for work, for family, for friends, for all the things that are really important in life. It also has an impact for food recovery organizations. And while this left column is the column that moves me and makes me want to do the work I'm doing, the right column is the column that allows us to do the work that we're doing. Telling this story of food rescue and the impact that food rescue has can help you raise money. It can help with volunteer engagement. It can help secure community partnerships. And just overall, it can help increase an understanding and awareness of the work that you're doing. It's really important and all of you know this, we're all nonprofits. We're fighting for the money that we need to run our program so that we can pay our people so that our people aren't food insecure. Understanding the value of the work that you do is critical so that you can tell that story so you can keep doing the work that you do. So increasing food access by going outside the normal network not only is truly really good work and making a systemic change in society, but it also lets you sort of highlight how food rescue is truly a different and impactful program to run. I'm going to say two things before we turn it over for questions. One, we are having the first food rescue conference next month, October 20th and 21st. It will be live streamed. We urge you to sign up and attend for the live stream. There's going to be 2 full days of content. About 8 hours each day of really good panels, including funders, actual, people that work at foundations that are going to talk about what makes them, throw a grant application out without even reading it versus what makes them read on. Retailers, national retailers like Kroger and Albertsons that are going to talk about, what makes them want to work with somebody, experts on climate impact of food rescue and so on. And you can, if you haven't gotten the link to register, Jake is going to drop that in the chat. but I will tell you that we're going to send a survey after this webinar. If you complete that survey, you will get 20% off your registration. So you might want to wait to register until after you fill out that survey and get your coupon. With that, I'm going to open it up for questions. Jake, what do we got?
We don't have any questions right now, but I'm also going to drop your Calendly link into the chat as well as your email. So if anybody wants to get in touch with you, they have access to that quickly.
Shelly Lee asked if we have an app. We do actually have an app. And if you're interested in finding out about that, I would say just grab my the Calendly link that Jake is dropping in the chat and set up a time to chat with me. You know, we can just even a half an hour and I can introduce that to you. I will tell you, I'm probably don't have a lot of availability until after the 20th. I am super, super busy trying to get this conference together and launched, but you might get lucky and find a spot. So go ahead and give it a try. Okay. Other questions about food access?
Joanne in the chat just asked, how can you address some territory issues with other food banks and organizations?
Well, when it comes to distribution, there should not be any territory issues. Nobody owns the right to distribute food to a housing site, potentially. There are so many organizations out there that serve people that are food insecure that I'm certain you can find some that don't have those territorial issues. Pantries might, traditional pantries, but again, that's another reason why to go outside that traditional pantry network. I mean, we work with pantries too. Pantries are great, and I would never suggest not working with pantries, but pantries can't handle the full amount of food that you recover when you really ramp up your operations. And so that's just another reason why to look for partners to go along with the pantries.
Shelly was also asking anybody else available to talk to probably about the app. I mean, I'm certainly available over the next couple weeks, although I think that Jen would be an instrumental part of that process. If you just have simple answers, I can also drop my email in the chat and I can answer some preliminary questions, but couldn't get too far downstream. So
yeah, Jake, if you want to go ahead and set up a call with her, that's fine. Andrea asked what my position is and where we work out of. So I am the head of partnership growth at Food Rescue Hero. I'm also the chief operating officer at 412 Food Rescue. So I am, involved every single day in food recovery. I'm not talking out of turn on this. And we operate 412 Food Rescue is in Pittsburgh, and our Food Rescue Hero network is all over the country and in Canada.
Yeah, I am the senior manager of partner relations, and I am working out of Chicago. But again, most of my meetings are with people all across the country. So it's mostly done virtually.
Yeah, it's all virtual. In fact, Jake is in Chicago, which he probably just said, but I was reading the chat that I missed.
Yep.
Transportation hubs is such a good idea.
I know. Yeah, that was
I really like that. So one of the things about alternative distribution locations is that currently the Bill Emerson's Good Samaritan Act only protects you if you're distributing to people who are actually in need through a 501c3 or a nonprofit. If your organization is a nonprofit, you can, that covers the nonprofit part. But the Food Donation Improvement Act that is before Congress right now and is expected to pass would actually allow for direct distribution to people in need. And so that would kind of make it a little bit easier to go to a transportation hub and distribute. I honestly don't think you'd have an issue if you went to a transportation hub and distributed. I think there's enough ambiguity in the Bill Emerson Good Samaritan Act. If you're a 501c3, that you would be able to be covered. But
on that note, I know that there are in Chicago that I've seen refrigerators that are just kind of placed, next to businesses or on the street in certain places. that are stocked with food. I forget the name of the nonprofit that runs it. It might be like Love Refrigerator or something like
Mhm.
that, which could be a really interesting model to use at transportation hubs. But also if you were to staff them with either a person or a volunteer, that could be something, a
Yep.
way to safely distribute food at transportation hubs.
There's a question about food safety. So this is a great question. Food in transit from a grocery store to, let's say, a Head Start program is no different than food in transit from a grocery store to your house, right? Most people, unless they live maybe in Arizona, and it's the height of summer, and they don't have air conditioner, don't put their food into into passive cooling in order to transport it home. With Food Rescue Hero, we actually use time as a safety control. We've worked very closely with the food safety departments at a retail chain that's regional called Giant Eagle. And we've worked with our health department, and they've all agreed that time is an adequate control to protect food for safety reasons. And because of our technology, we're able to track how long food's out of refrigeration. If you're not using technology, then you probably want to do something else to make sure that your volunteers understand the timing constraints and make sure that your nonprofits understand that as well. Once it gets to those nonprofits, it goes into their refrigerator before it's given to families at the end of the day. So, it's cooled, and then again, it's just like taking it home from the grocery store. So it's no different than, let's say I go and I buy a pre-made salad at the grocery store. I drive it home, and then tomorrow I take it to work and I drive it to work and put it in the fridge again there.
And keep in mind, this is a system and method used to transport generally smaller amounts of food. So it's not long haul trucking where you're transporting it several hours across state lines. It's usually within communities and pretty hyper local.
Yep. Okay, well, are there any other questions before we wrap up? You're all going to get an email in a few minutes, and it's going to have a link to the survey. I'm really interested to hear what other topics you'd like to hear about. If there are any other speakers you want to hear from, and what was really good and what was really bad. Don't mention the fact that I had to run away and answer the door in the middle of it. And once you fill that out, you can get 20% off your registration for the conference in October. All right. Well, thank you so much, everybody. We really appreciate your attendance today and your questions and your contributions. I'm going to take a look at our transportation hub as soon as I get off this call, I'm sure. All right. Bye, everyone.